Hi, good afternoon, everyone. Thank you guys for joining us for this Protect Our Care virtual town hall, which we are calling Your Health, Your Vote. And we are just trying to make sure that we continue the conversation about how important healthcare is to Nevadans, and in particularly the future of healthcare as people are contemplating what's going to happen in the next few weeks. So today we have a remarkable panel. No one logged on to hear me talk. We want to listen to this incredible job that our delegation and that these leaders in our community are doing. So our first speaker that we have today is someone I'm very proud to call a friend, a former colleague and a former boss, who is a senior senator for Nevada now, Miss Catherine Cortez Masto, and she has been an incredible advocate and champion for healthcare and to make sure that Nevadans have access to affordable and quality healthcare. And it's something she's been fighting for throughout her career in the Senate, in addition to protecting Medicare and Medicaid. So joining us now, we have U.S. Senator Catherine Cortez Masto.
Andres, thank you. And thank you all for joining us. I'm just so pleased to be able to be here with my colleagues and some incredible friends who have been on the front lines of fighting to ensure we have access to healthcare. It seems crazy in the middle of a healthcare pandemic that there are still some, this administration, some Republicans that want to take away healthcare. It's just, it seems nonsensical, but that is what is happening right now. And people need to know the truth. Right now we've been hit so hard by this healthcare pandemic. And I will tell you, even before the pandemic, we were working to make sure everybody had access to affordable coverage in healthcare in this state and in this country. And in fact, we are one of the states that expanded healthcare under the Affordable Healthcare Exchange to hundreds of thousands of Nevadans, 1.2 million of whom have pre-existing conditions. And then the healthcare pandemic comes along. Well, I've been in the Senate for 3 years now, and I was there in 2017 and watched as Mitch McConnell and the Republicans led the charge to eliminate the Affordable Care Act. And thanks to some of my colleagues on the other side of the aisle, but most importantly, John McCain, we all remember when he came in and put his thumb down and saved the Affordable Care Act. Well, they have been working hard since then to continue to dismantle it and do away with it. And what you see playing out in the Senate Judiciary right now is a continuation of the Republicans and this administration's goal to put somebody on the Supreme Court who will be the deciding vote to dismantle and do away with the Affordable Care Act. What people don't realize is a week after the election, there is a case that is going up to the Supreme Court that will focus on whether or not the Affordable Care Act is constitutional or not. It was brought by several Republican attorneys general, but then it was brought by those AGs, some of my Republican colleagues joined in, and this administration, the president joined into that federal lawsuit to do away with the Affordable Care Act. So that's what's happening right now. And that's why it is so important. We are all talking about the importance of healthcare, its impact, and how it's helped so many in the state of Nevada and across this country, and why we still need to fight for it. It is crazy to me, and I know my colleagues and all my friends that are joining us feel the same way. Why are we still having to fight to ensure somebody has access to healthcare, particularly in the middle of a healthcare pandemic? But it's happening because this administration continues down the path of wanting to take it away. They've been there for almost 4 years now and do not have a plan to replace it. Even though they claim they do, there is no plan to replace healthcare in this country if they take away the Affordable Care Act. So this is really the issue of the day for so many people. I know my colleagues, we hear it all the time. I get so many mail, letters, contacts, phone, emails into my office in the Senate from so many people who have access to healthcare because of the Affordable Care Act, and they do not want to lose it. In the middle of a pandemic, 79,000 people in the state of Nevada came down with COVID. Across the country came down with COVID-19. Now they have a pre-existing condition, 79,000 Americans. And so our goal here is really to expand and make sure everybody has access to healthcare. That is our fight. But unfortunately, too many are trying to take it away. So let's talk about it. What you're going to hear today on this discussion in this panel is the discussion about why it is so important here in Nevada to ensure that we keep the Affordable Care Act and give access to healthcare to so many people and the consequences of it being taken away. So thank you for joining us today. And I so appreciate the conversation. Andres, I'm going to return it back to you.
Senator Masto, thank you so much for joining us and for your courageous fight these past few years. When she was elected to the Senate, she unfortunately did not have a colleague who was joining her in this fight, but now she does. We had an election in which our previous Senator, Dean Heller, who was not very actively supporting and fighting for the Affordable Care Act, was replaced by Senator Jacky Rosen, who is a champion for the Affordable Care Act. And so we are excited that Nevadans chose to give you some help and support in the Senate, and a champion and leader that is Senator Rosen. And so, Senator Rosen, I will turn it over to you for you to share with us about the importance of this.
Well, thank you, Andres. Thank you, Catherine, and everybody for being here on the call. I want to start out always by saying first that I know what a difficult time it is for everyone, not just professionally, but personally. And I hope that you and your family, your friends, everyone you know and love is safe. And I say this on every call because it is always true. The only things we can't replace in life are the ones we love, which is why we're fighting for healthcare, while we're fighting to protect pre-existing conditions in the middle of a pandemic. People are dying unnecessarily. And so we're going to continue that fight. And I'm proud to be here today. And I know how challenging it has been for all of us. We're going to work to overcome all these obstacles. We have to address these issues. I can tell you, just like Catherine said, and I know that Susie and Dina, and if Stephen were on the call, he'd say the same thing. Literally thousands of people have contacted our offices. I had 17,000 emails the week that Ruth Bader Ginsburg passed, with people worried about that Supreme Court fight coming up in just a couple weeks in November to take away the ACA and remove those protections for pre-existing conditions and the like. And the Affordable Care Act has given so many just peace of mind. Affordable coverage, they have access to quality, they don't get denied, the lifetime caps are removed, they have preventative care, and it's really opened the door for thousands of families. And like Catherine said, 1.2 million, we only have about 3 million people in our state. So 1.2 million people live with pre-existing conditions, and that doesn't count everyone who may have gotten COVID in the last year or will continue to get COVID. They will be labeled having a pre-existing condition. We can't exclude them from getting coverage. We don't even know what kind of repercussions COVID is going to have for any of us in the short term or in the long term. And so today I want to say thank you to everyone who's in the fight with me, and really for supporting the ACA. Because of the ACA, more than 200,000 Nevadans get coverage through our expanded Medicaid program. 77,000 Nevadans have coverage through Nevada Health Link, and 19,000, over 19,000 Nevadans under the age of 26 can stay on their parents' health care plans. Middle income Nevadans have access to affordable coverage. They get the much needed tax credits. All of that's so important. And 210,000 people dead from COVID. The devastating impacts we don't even know about that's going to happen because of COVID-19. Without the ACA, people are living in fear, not from what they already have, but from what they could anticipate. And so we need the healthcare coverage more than ever. And I'm really proud to work with all of you, organizations like Protect Our Care. Of course, I know we have Planned Parenthood. We have all the organizations on here today. I am proud to be your partner in so much of this. And we're watching today, Catherine and I, our colleagues in the judiciary. We're going to have a new Supreme Court justice. That case is going to be heard in early November. And we have to do everything that we can to be sure that we protect the ACA, that we don't allow the devastating effects of its repeal to happen to the working families in Nevada and for all of our healthcare to be jeopardized. And so together, we're going to do everything we can to protect pre-existing conditions, to protect all of those 10 essential health benefits. I know what I heard in 16 and what I heard again in 18, and why I was the only challenger to beat an incumbent in 2018 was that healthcare was on the ballot, and it's on the ballot now. So we're here to learn and to listen. I unfortunately have a conflict that just came up. Obviously, we're going back in session next week, so some of our committees are trying to figure out what's going to be on the agenda next week. I'm going to leave it to my able-bodied colleagues in the House to listen and answer your questions. And thank you for everything that you do. And please be well and safe out there. Andres, back to you.
Thank you, Senator Rosen, for taking the time to join us for this important event. Our next speaker, also a longtime friend, someone I've known since high school, actually wrote my college reference letter and was in the House when the debate for the ACA was going on, and was able to help usher in this law that we're talking about. So I'm going to turn it over now to Congresswoman Dina Titus, who's been fighting for us for many, many years in Congress, and we're so thankful to have her leadership and her courage during these times.
Well, thank you, Andres, and thank you for bringing us all together to talk about this critical issue. You've been leading as one of the people in Nevada who've helped to enroll so many people in this program over the years it's been in existence, and that's been very important. You're right. I was the only member of this congressional delegation who was there to vote for the Affordable Care Act. And it was one of the most significant pieces of legislation that I was proud to support. And it was a tough battle. One of the things that we did in the House was to put in a public option that got taken out by the Senate, but we're moving towards expanding it perhaps in the next administration to include that public option. In the time I've been there since then, we have voted over 60 times against Republican efforts to do away with the Affordable Care Act. They keep promising that they want to dismantle and come up with something else, but they never come up with anything else. One of the reasons I supported the Affordable Care Act is because Nevada always ranked in the top second or third in the country for the number of people who were uninsured. We had a transient population. We had a number of people who worked part-time jobs, a lot of people in the service industry where they didn't receive employee health insurance. So it was a real critical issue. And certainly it has come about that the Affordable Care Act provided that needed coverage for so many of the people here in my district, which is the heart of the valley, but across the state. Over the past decade, Obamacare, which you can say proudly, you can call it that, or the Affordable Care Act, extended health coverage to almost 300,000 Nevadans. Think of that. No, they had no coverage until this passed, and then 300,000. What's also interesting is about 80% of those enrollees got some kind of financial assistance to help them pay for their insurance. There were just last year, as of last year, there were 77,000 people enrolled. But if you look at this year, there are going to be 50 plans that are available for you to choose from. That's double the number that's been available in the past. And there are 2 new insurance carriers who are offering programs through the exchange for next year. Think of how far we have come when in the beginning, there were 14 counties in the state who had no companies offering insurance. And that's what led me to introduce the Barrett County Buy-in Act of 2017. And now that pool of providers has grown considerably, and that's also a good thing. You've heard about the Supreme Court nominee. Well, it's very clear from her writings and her position statements that she thinks the Affordable Care Act is unconstitutional. And that's why they're ramming and jamming and trying to get her put on the bench before that comes up, which is 1 week, just 1 week from Election Day. They want her there to cast a vote, because if they couldn't get rid of it legislatively, They couldn't get rid of it through executive order, although they have chipped away at it. Now they want to try to get rid of it in the courts, and that's why they're pushing for her approval. You know, this is a terrible time to be getting rid of the Affordable Care Act right in the middle of a pandemic. I reached out to the Department of Health and Human Services to open a special enrollment period during this pandemic, and Nevada has been very flexible and done a good job of doing that special enrollment period for our residents back last spring. I've also supported allowing DACA recipients to get health insurance in the marketplace and receive those subsidies, and we hope to see where that goes. Certainly health insurance should not be, or health care or insurance coverage should not be considered a privilege. It is a right, and it's a right that all people in this country should have. We shouldn't be the wealthiest country around, or as wealthy as we are, and not allow people to be able to access health care. So the Affordable Care Act has really drastically improved the situation across the country. The expansion of Medicaid, coverage of pre-existing conditions, allowing children to stay on their parents' policy until age 26. Being a woman is no longer a pre-existing condition. You can't charge women more than you can men. And also insurance companies can't put that cap on how much coverage you're entitled to. If you have some disease when you're a child, some diabetes, then they can't cap you and say, oh, sorry, no more coverage for you. Now, I've been a supporter of Medicare for all. That's aspirational. I would like to see us move in that direction. It's going to be slow going, but what we should be doing instead of destroying the ACA is building on the ACA. And I know that that's what Vice President Biden wants to do, expand Medicaid in those states that don't have it, bring down pharmaceutical costs, because that's a serious problem. Let Medicare bargain for prices just like the VA does. So there are opportunities to expand on healthcare. That should be our goal. Build on the good basis of the American Affordable Care Act instead of trying to get rid of it. And make no question about it, healthcare was a very big issue in 2018 politically. It is on the ballot again. So I encourage people to vote their own interest and the interest of their families and friends to stay safe and as healthy as possible during this pandemic.
Congresswoman Titus, thank you so much for taking time from your schedule to join us. Congresswoman Titus has been a longtime champion for us in the House, but as with Senator Cortez Masto, she hasn't always had colleagues in the delegation who are fighting with her for the Affordable Care Act. And thankfully, Nevadans recently elected Congresswoman Susie Lee to join Dina Titus so that we have another champion in the House that can stand alongside Congresswoman Titus and fight for Nevadans and ensure that we are being protected and having access to quality, affordable health care. So Congresswoman Susie Lee, thank you so much for joining us, and we'd love to hear from you.
Thank you, Andres. Thank you for having me. And, you know, I was elected as part of a historic freshman class, and the issue that was on the ballot in that election in 2018 was healthcare. We had seen the Republicans repeatedly try to repeal the Affordable Care Act, and many of us ran in districts around this country in protest of those attempts to roll back what was a monumental piece of legislation that provided care to millions of Americans. As we're in this pandemic, this really brings home to me the struggle that we have. Many of you know, I grew up in Ohio. My father, at the age of 56, during the Rust Belt era, was laid off from his job at a steel mill. And he basically was unable to afford healthcare coverage because both he and my mother had high blood pressure, a pre-existing condition. Unfortunately, just 1 month before my mother qualified for Medicare, she suffered a major heart attack. And because they did not have health coverage, their home was at risk of being taken away from them. That is the stress that so many Americans, especially Nevadans now, should never have to face. And when I was elected into Congress, one of the first votes we took was to allow Congress to fight the Azar versus Texas litigation. And basically, and that's what's happening right now, and that's what's on the line. As we think about the millions of Americans who are suffering their livelihood, their lives because of this pandemic, and then the fact that instead of the Senate working on an additional aid package, they are basically working on or approving a Supreme Court justice so that they can ultimately roll back the Affordable Care Act. It to me is just unconscionable that this is happening at a time when many people, millions now, have a pre-existing condition as a result of contracting COVID from this pandemic. Nevadans have a team of fighters in the House and the Senate, and we will continue to protect healthcare, especially at this time. I've received thousands of pieces of mail from my constituents about protecting the Affordable Care Act, especially protections for those with pre-existing conditions, whether you're diabetes, a heart condition, cancer, rare diseases, are writing me and explaining what would happen in the financial ruin that their families would experience if they did not have the type of coverage that the Affordable Care Act has. Now, if this administration is successful in their lawsuit, think about it, 23 million Americans would have their health care ripped away, and protections for more than 135 million people with pre-existing conditions. The president says repeatedly that he doesn't support eliminating coverage for pre-existing conditions, yet actions speak louder than words. So I'm here to join my colleagues in standing up for our healthcare, and I call on this administration to drop the lawsuit, to work with us to improve the Affordable Care Act and protect all Americans. And I call on the Senate to refocus its time and energy on getting much needed relief to Americans rather than repealing the Affordable Care Act. So thank you for having me, Andres, and thank you for continuing the fight. This is such an important fight, one that affects every single family in this country and one that we cannot give up on.
Congresswoman Lee, thank you so much. And, you know, we wouldn't be able to have this fight without champions like you and Congresswoman Dina Titus in the House. So all the credit goes to you guys that give us the ability and the motivation to continue doing what we're doing. Our next speaker is also a longtime friend who is the new president of the SEIU that represent thousands of nurses and government employees who are frontline workers here in Nevada. They are such a critical part of the healthcare infrastructure, but also what's happening just in Congress, advocating for the ACA and ensuring that Nevadans have the COVID protections they need. So joining us now is Kevin Carey with SEIU.
Thank you, Andres. As Andres mentioned, my name is Kevin Carey. I'm the president of SEIU Local 1107, and we represent over 9,000 hospital workers across the state of Nevada. Those members have been on the front lines of this pandemic from the start. And this administration's actions and this president's failure to address the pandemic properly has put those 9,000 workers in jeopardy every day they go to work. And I, for one, can't even imagine what it's like for those workers to know that every day they go to work, they're going to come into contact with this virus and possibly take this home and expose their loved ones. But they continue to go to work every day to serve our community, and I believe we owe them all our gratitude and respect. This president's failure to listen to experts and the lack of a national strategy to combat this virus is the reason why 7 months later, we're still in this pandemic with no end in sight. We have over 200,000 deaths, over 1,600 here in Nevada, close to 8 million infections nationwide, and countless lives have been changed forever. And you know, it didn't have to be this way. You know, the experts from the beginning have laid out the path to combating this virus. Wear a mask, wash your hands, keep 6 feet from people. But we have a White House that even refuses to follow even those basic requirements. And you know, leadership should come from the top, and this president has failed. And if that wasn't enough, right here in the middle of this pandemic, they want to dismantle the Affordable Care Act, which all of our speakers have mentioned. Many of those people here in Nevada are benefiting from this Care Act, and if we take it away, they're going to be stripped of their health care. The choice we have to make in this election is very clear. We need true leadership in this White House. We need a national plan to combat this virus, and we have to listen to the experts and trust the scientists. We're not going to be able to get back this economy, get our children back in school, or our lives back to normal if we continue down the same path that we've continued for the last 4 years. I believe that this election is one of the most important of our lifetime, and I believe that we need to get out there and support the Biden-Harris ticket. I'd like to thank you all for letting me speak today, and I'll throw it back to you, Andres.
Kevin, thank you so much for joining us. And again, thank you so much for all the hard work that SEIU members are doing day in and day out to serve Nevadans and to protect Nevadans during this process. Our next speaker is Laura Martin, who's the Executive Director of the Progressive Leadership Alliance of Nevada. Ever since I can remember, people have been advocating and fighting for healthcare and the Affordable Care Act. Laura Martin has been one of those people on the front lines advocating for better quality access to Affordable Care Act for Nevadans through her and through PLAN. And so I'm just very thankful for all the hard work that PLAN has done during the past several years, the hard work they continue to do, the fact that they understand this is an ongoing issue, something we can't let from. And just thank her for joining us today to talk about the efforts that PLAN is doing and why this is so important for Nevadans still today.
Well, thank you, Andres, and thank you everyone who's joined on the panel today, especially members of our congressional delegation. We're so lucky to have so many women leading us in Nevada. Definitely when I moved here more than 10 years ago, our congressional delegation did not look like what it does today. And for that, I'm really grateful for all the activists and volunteers who worked hard to make sure our voices are represented by people who are fighting for us every day. In terms of healthcare, I feel like the COVID crisis has really exposed how damaging this current administration has been to healthcare. Pre-existing conditions is something that's very important to millions of people, especially with people who now have COVID, but also the caps on coverage is something that's very important. Even for me personally, someone who's had a heart murmur and knows what it's like to be denied coverage because I've already met my limits. And so that is another process that we could see go away with that November 10th Supreme Court case, with possibly a new Supreme Court justice doing the work of President Trump and eliminating the Affordable Care Act. But as we think about healthcare, we also have to acknowledge that people of color are disproportionately affected due to underlying health conditions as well as environmental racism that piles on top of the already damaging disease of COVID that affects people's respiratory systems. And I also want to lift up, and I'm hoping our congressional delegation can address the fact that there are still thousands of more Nevadans, despite having the Affordable Care Act if we were to expand Medicaid or the ACA, but thousands of Nevadans who are undocumented, but still work here, live here, and raise families. And they need access to healthcare too. They need to be able to see a doctor if they're feeling sick without the fear of not only not being able to pay, but being confronted with anything that could affect their immigration status or their lives here in this country. If we remember the October 1st shooting, that was an issue that was exposed. Many of the workers who were working at Mandalay Bay in the concert venue did not have status, and they were afraid to seek mental health services. They were afraid to go to the doctor because they were afraid of running in with law enforcement who could report them to ICE. So I strongly, strongly, strongly push all of our members of Congress to just remember that there are thousands of people that are also working hard, are also raising families. And you know what, even the people who don't work hard deserve to have healthcare. They deserve to have that peace of mind that just because you aren't a citizen, but if you live here, you work here, you're making your life here, and heaven forbid you catch COVID-19, you should not worry about paying out of pocket or worry about being confronted with ICE or Border Patrol, anything at our hospitals. So I hope that our members of Congress can also take that on in terms of protecting the ACA and also expanding any relief packages that we have coming for COVID. It was already disappointing for a plan and all of our leaders across the state that undocumented people were left out of the stimulus package, including mixed status families, meaning one partner may be a US citizen and they're married to someone who's undocumented, so they got nothing for their families. All families here deserve the same type of stimulus and support to make it through this pandemic. We need to be fighting to make sure that every single Nevadan, no matter if they live in Clark County or Eureka or Elko, every Nevadan needs to be able to come out of this pandemic whole. We cannot leave anyone behind. And this definitely cannot be a trickle-down recovery where we just force feed billionaires tons of money, hoping one day it'll reach down to the rest of us. We need to make sure that we're helping the people who are frontline workers, who are essential workers, and making sure we're supporting those families and getting everybody back on their feet. And again, I just want to thank Andres for always bringing up this issue. I think sometimes we think that the healthcare issue is solved, but really the Affordable Care Act, or if you want to call it Obamacare, has been chipped away piece by piece. It hasn't been enforced. And yes, Plan wants Medicare for all. We want healthcare for all, but we have to start by getting everybody covered. That's what the Affordable Care Act does. We need to build on that. We need to expand it. And we also need to make sure that we're not just providing people health insurance without any ways to see a doctor, but we also have to address the disparities that exist in the rural parts of Nevada where people just don't have a doctor to go to and maybe don't have the means to access telemedicine. So thank you again, Andres, for this. And I really hope people, as they go into the voting booth, really consider who is actually fighting for your families and is considering supporting you through this process and getting us out of this COVID crisis as whole people, as whole families, stronger than before. Thank you.
Laura, thank you so much. And your comments are just another reminder of why you're such an important voice in this conversation. So thank you for joining us. Our next panelist is Raquel Cruz Juarez, who's from Planned Parenthood, whose organization is no stranger to the healthcare fight and fighting to make sure people have access to quality healthcare, especially with the Supreme Court nomination coming up that's happening. And so I'm going to turn it over to her because I'm sure she has a lot to say about this issue and why it matters so much.
Thank you, Andres. I really appreciate you all being here today. Good afternoon. As Andres said, I'm Raquel Cruz Juarez. I'm the Director of Public Affairs for Planned Parenthood of the Rocky Mountains and Planned Parenthood Votes Nevada. As you know, Planned Parenthood health centers provide life-saving care for over 18,000 Nevadans annually, many of whom are covered by the ACA. In fact, back in March of this year, we celebrated the 10-year anniversary of this historic passage of the ACA, which has helped millions of people in the country by expanding access to quality reproductive health care, ensuring protections for people with pre-existing conditions, and requiring health plans to cover essential health services. Gains that are even more important now that the country is facing the COVID-19 pandemic. To give an example, Medicaid is the largest payer of reproductive health care, covering 43% of all births in the United States and 75% of all family planning services. You know, back in college, I was one of those people who the ACA helped. When I was a college student, I was covered under the ACA. I had a lot of health issues and I went to the doctor, and it was there where I was diagnosed with polycystic ovarian syndrome, otherwise known as PCOS. A lot of women live with PCOS, and I was able to get on birth control to regulate my body thanks to the ACA. Obviously, at the time, I didn't understand the importance. I just remember my parents asking me to enroll as a college student, and I'm very thankful for that. And I know that that's the reality of many Americans for the past 10 years. My story is not unique. It's the reality of many Americans. And the ACA has made monumental progress improving people's life across the country, but it's been constantly under siege. The current administration and its allies in Congress have tried time and time again to sabotage, repeal, and gut the ACA, all in an attempt to take away essential healthcare from people who need it most. If you all were around in 2017, when then Senator Dean Heller voted multiple times to struck down the ACA and to defund Planned Parenthood, well, he's no longer a senator. So that shows you the importance of healthcare and how healthcare continues being the #1 issue, or if not at the top 3, of why voters are voting. It's an important reason why people go to the ballot box or return their ballot every single day. These repeated attacks on the ACA are deeply felt now as the government's lack of response to the COVID-19 pandemic is impeded by the years-long effort of this administration to cut and gut our public infrastructure, which includes the ACA. But today, millions of people have access to better coverage, including access to reproductive health care services that were out of reach before the ACA. And Planned Parenthood Votes Nevada, just like we did in 2017, will hold everyone accountable that gets voted in next month or that has been already in Congress or in the Senate. We will do everything in our power to protect those important gains from political attacks because healthcare is not politics. Folks on the other side of the aisle definitely make it political, but to a regular voter every single day that isn't involved in this fight, they just want the dignity to live healthy with their family, regardless of where they come from or who they are. They simply want to be healthy. Thank you, Andres. I'll throw it back to you.
Raquel, thank you so much again for all the hard work that you do and that your organization does to serve Nevadans and to make sure that people have access to quality health care, especially in some neighborhoods where you're the only resource that they have. Our next speaker is Miss Erica Washington, who is the Executive Director of Make It Work Nevada, who is a fierce advocate for all things that are important to Nevadans. She's been an outspoken advocate for the Affordable Care Act and access to quality affordable health care for people in her community. And so we're extremely thankful that she's joining us today also to talk about why it's so important to her and to her organization that we continue this conversation.
Thank you so much, Andres. I am so excited to be here, and I appreciate that you always invite me to be a part of your panel discussion. So, and I will say this is the first time I've been on with so many like really dope Nevadans, so I'm excited about that. As you said, I am the Executive Director of Make It Work Nevada, and I have been a part of the Make It Work family. We were at one point a national organization, and I've been a part of that since 2015. And so I have come across so many people who have had so many heartbreaking struggles around, economic, racial, or reproductive justice issues. So whether that is affordable childcare or equal pay, paid family leave, not having access to health insurance, all of these things, they're interconnected. And so when you listen to what the folks have said over the years about not having access to health insurance and not having access to quality care as well, I feel like at this point we shouldn't even be having this conversation anymore. Like, we should be to the point where we're concentrating on the quality of care and not access to it. Everyone should have access to health care because it's not a luxury. This isn't something that only the rich deserve or people who have certain jobs or careers deserve. Every single person on this planet deserves actual health care, right? Some of you may know that I recently had surgery at the end of July, and I am still in recovery stage. But what I do know is that the surgery that I had stemmed from a car accident that I had over 5 years ago, 5.5 years ago. And so my current insurance may not have covered that if it wasn't for some of the legislation that has passed because of ACA, that I could have been stuck in pain, for a very long time, or had to come up with a lot of money to try to help myself. And that shouldn't have to be how people think about, whether or not, should I have this surgery in order to alleviate pain so I can live a better life? Or, should I, go into debt? Or should I miss work and possibly lose my job? Like, these are not questions that people should have to answer. I think about, COVID and what that has done and how it's brought to light so many inequities, Nevada residents grapple with, and, how many people go without care. And I think about, this is not just for individuals to have care, but this is for the collective. We are a state that prides itself on being like welcoming the entire world here. We want everyone to come here. We want everyone to come and have a great time. We can't do that if we don't have adequate health care to take care of the residents here and for those people to be able to take care of their families. Many schools across the country are reopening, but at the same time, many schools are scheduling to close, including our own UNR. I have a daughter who is a senior at UNR currently, and just recently they've made the announcement that they're going to close the campus as of right after Thanksgiving. And so what does that mean? That means there are going to be a lot of students who will no longer have access to the dorms. That also means, including my daughter, will no longer have a job on campus. So COVID has affected people in so many ways that it's more than just healthcare. It's affecting the livelihood. And so if we have, better healthcare overall, it shows just how dependent we are on each other. And all I can say about this administration is that they've just had a complete disregard to anyone, not just Americans, but it seems as though they believe that we are a disposable population. And the only way that we actually show folks that we are not disposable is as we vote and we push for the things that we deserve as Americans and as human beings. And, I think I'll end there with just saying that, overall, this pandemic has brought to light just how close we are. And it's also brought to light just how much it's had no mercy on those most in the margins. There are people that may never truly recover from this pandemic, and that includes not only their health, their physical health, but also their mental health and also their financial health. And so, now is the time for us to make as much change as we can and to raise our voices as much as we can. And we can only do that collectively through organizations like Planned Parenthood and Plan, and with our leaders that we vote into office. And so I am looking forward to I almost cussed and said what I want to do with getting rid of Trump, but we're just going to vote him out. And I can't wait to have a party once we do it. Thank you so much, Andres.
Erica, thank you again for joining us and for all that you do in your efforts to fight for Nevadans. We are going to stop and take an opportunity for Q&A. I'm going to let Mika give the process for how to do that. So Mika, if you want to just take over and let people know how they can log in the queue.
Awesome. Thank you, Andres. And thank you to all of our panelists and to our audience for joining tonight. If you would like to ask a question to one of our panelists, please use the chat box to ask your question and state who you would like to direct the question to. If you're on Facebook, please enter your question into the comments now. Again, if you would like to ask a question, please go ahead and enter it into the chat box or the comments now. Our first question.
You have a first question?
I do.
Okay, awesome.
Yeah. So our first question is, what is for any of our panelists? What does the accelerated timeline to confirm Amy Coney Barrett as Supreme Court Justice say about Senate Republicans' priorities during a national health crisis?
I'll answer that. I think it's tragic. When we think about the fact that, first of all, millions of Americans not only have lost their livelihoods so we could save lives, and primarily because this administration has failed at handling its approach to this virus. And then to think at a time when we are now adding more people to our rolls of those with pre-existing condition, over 210,000 people have died from this virus, and we still have yet to get another package passed of stimulus payments and extended unemployment, rental, mortgage assistance, state and local funding. We passed that out of the House, the HEROES Act, over 5 months ago. It's not like this is something that's brand new. And yet they are going to take the time to focus on this as their priority, appointing a Supreme Court justice just in time so they have that vote on to repeal the Affordable Care Act. I think it is disgraceful, and I think the American people deserve better.
Yeah, I definitely agree. This actually ties in really well to our next question, which is from Andrew Davey from Nevada Today, to any of our panelists. Andrew asks, should Senate Republicans succeed in confirming Barrett to the Supreme Court? And what would you like Congress to do to shield the Affordable Care Act from a potentially adverse ruling?
I don't have the answers, but I'll answer it. I just feel like we're in an unreal situation where we are just weeks away from an election. We're in the middle of a pandemic. This Supreme Court justice's nomination was kicked off with a super spreader event. She even put her own children at risk. And it just seems like a complete joke that we're actually considering putting somebody on the Supreme Court despite all of that. I do feel like, unfortunately, all we can do is have a new Congress on both sides, protect the majorities that we have in the House, and demote Mitch McConnell. It's just distressing that we are in this position where there are thousands, tens of thousands, hundreds of thousands of people who are getting this illness because our president is such a buffoon. This could have been prevented. We don't all have to be locked in on our house still in October of 2020 when this is something we knew about in January. But unfortunately, these are the cards we are dealt. And this is what happens when you elect a president who doesn't care about anything but himself. And so and anyone can push back. I just feel, unfortunately, there's not much else we can do other than push to make sure we have strong people in the Senate, in the House, who will fight with everything they have to get some strong protections in there. Because unfortunately, it just feels like this justice is just going to be confirmed.
I think the American people have an opportunity right now to express their extreme distaste with what's happening. And I'd love to see it at the ballot box and making sure that we are getting rid of these senators who support repealing the Affordable Care Act at a time when we need it the most. And then we'll have a majority in the Senate and a majority in the House and a president sitting in the Oval Office. And, you know, the president has, his plan is to expand, allow for a public option, allow for people to opt into Medicare. So I think that should they be successful, I believe that the American people will stand up and will have a chance to improve healthcare for so many.
I'd like to add to that, despite the question being focused on Congress, I think it's also very important to ensure that state and local leadership is also in line with protecting Nevadans specifically, or just protecting their electorate, because that's what happened in 2017, right? We made sure that when then Senator Dean Heller was voting to strike down the ACA and to defund Planned Parenthood, that the stories from the ground are being heard. Real Nevadans were like taking on leadership positions to make sure that, because sometimes we just can't always depend on Congress. A lot of it trickles down to state leadership and the protections that are going on the ground, whether it's through organizing or through local state mandates. That's very important as well. So I think emphasizing state leadership and local organizing is important in this fight as well.
Yeah, there is nothing more important than our local level of organizers and elected officials. One more question that was submitted online. If the Affordable Care Act is eliminated in November, how could those with pre-existing conditions, including those who have had COVID-19 and are now suffering longer-term health consequences, be affected?
Well, I think we all know what it was like before the Affordable Care Act was passed, and how people with pre-existing conditions were being discriminated against almost on a daily basis from a variety of issues. So I think the issue here that people need to worry about is that COVID-19 is real, that the probability of overturning the ACA is real, and that if they're not taking care of themselves and paying attention, that in the very near future, an additional, hundreds of thousands and millions of Americans are going to be diagnosed with a new pre-existing condition that insurance will no longer be required to cover or protect them from if this continues to happen and Republicans succeed in their efforts to overturn the ACA. But I'm sure that my Congresswoman Susie Lee has a much better answer.
Well, I think about where we were, like you said, before the Affordable Care Act, where people, because of pre-existing conditions, were either charged exorbitant premiums or had exorbitant deductibles. But more importantly, when you think about all of the children who now have access to healthcare, who can now get preventative screenings, who can get the healthcare that they need. We talk about the disparities that exist with communities of color. And we think about, the maternal mortality rate for African-American women, all of these factors that are indicators of the health disparities are just simply going to get worse. That's all there is to it. I mean, I think back to the struggle that my parents went through, and basically they were never able to get any preventative care because they couldn't afford the health insurance. And to me, I think that's the biggest shame about what is going. I mean, that, you know, since the Affordable Care Act was passed, for years, every time you turned around, there was an attempt to destroy it or tear it down or damage it. And, you know, and then think about all the millions of Americans who now have that access, and it will be gone. And I think it's going to be, and especially now as we're coming out of this pandemic, the economic recession that is soon to be a depression if the Senate does not join us in passing the HEROES Act, it's going to be truly devastating across this country.
Yeah, definitely. Thank you so much for everyone's comments. I believe that is it for our questions. So I will toss it back to you, Andres.
Mika, thank you so much. And I just want to take time to thank Kevin with SEIU, and Laura with Plan, and Raquel with Planned Parenthood, and Erica with Make It Work Nevada. The work you guys do is truly invaluable to Nevadans, and even to the Nevadans that don't know that you're fighting on their behalf. It is still important that you continue to raise your voice. And Raquel, as you have said, your efforts, we didn't always have a congressional delegation like we do now, that is so focused on healthcare and that is so active on these issues. And it is because of the work that you guys do that we have members of Congress like Susie Lee, who is able to be a steadfast champion. She knows she has allies in her state that have her back. She knows that there are thousands of Nevadans out there who are suffering real stories. These aren't just talking points to her and statistics to her. These are real people that she meets on an everyday basis. I want to thank Congresswoman Susie Lee because, again, she doesn't just lead with her words, she leads with her actions. She is continuously out there fighting to make sure that Nevadans have the access they need to Affordable Care Act. She is continuously taking the votes she knows needs to be taken to make sure Nevadans are protected. She is out there in the trenches, not just behind some ivory tower or some guarded gate, but she's out there meeting with real Nevadans, making sure they know that she's there for them. I am truly honored to live in her district and to call her my Congresswoman, and to see the amount of work that she's done for Nevadans and continues to fight. So just thank you so much, Congresswoman Susie Lee, for being with us today, for joining us, and for all the work that you have yet to do, because I know the fight isn't over and you are going to continue to be out there fighting to improve the well-being and the livelihoods of Nevadans. So thank you guys all so much for joining us. Thank Catherine Cortez for joining us earlier, as well as Senator Rosen and Congresswoman Dina Titus. I look forward to working with you guys over the next few weeks. The fight isn't over, but thank you so much for what you do to continuously stand up and to join us in these important conversations. And I look forward to seeing you guys out there in the field. Have a good evening.
Thank you.